Question 1. A nurse needs to administer a medication dose of 0.75 milligrams. The medication is supplied as an oral solution with a concentration of 250 micrograms per 5 milliliters. How many milliliters, ml, should the nurse administer? A. 1.5 milliliters. B. 10 milliliters. C. 15 milliliters. D. 30 milliliters. Answer: C. 15 milliliters. This question tests dosage calculation, which requires an initial unit conversion. The ordered dose is in milligrams, mg, and the available medication is in micrograms, mcg, so first convert 0.75 milligrams to mcg by multiplying by 1000, which gives 750 micrograms. Next, use the available concentration to calculate the volume. If 250 micrograms is in 5 milliliters, then 750 micrograms will be 750 micrograms / 250 micrograms, asterisk 5 milliliters equals 3 by 5 milliliters equals 15 milliliters. Always ensure all units are consistent before performing any calculations to prevent critical medication errors. Question 2. Read the following passage. Effective communication is paramount in healthcare, fostering trust and ensuring patient safety. Nurses must not only convey information clearly but also actively listen to patient concerns, interpret nonverbal cues, and tailor their language to the patient's level of understanding. This multifaceted approach prevents misunderstandings, promotes adherence to treatment, and ultimately leads to better health outcomes. What is the primary message of this passage? A. Nonverbal cues are more important than verbal communication. B. Nurses are solely responsible for transmitting medical information. C. Clear and tailored communication is vital for patient safety and outcomes. D. Patient understanding is the least important factor in treatment adherence. Answer: C. Clear and tailored communication is vital for patient safety and outcomes. This question assesses reading comprehension, focusing on identifying the primary message. The passage repeatedly emphasizes that effective communication is paramount, requiring nurses to convey information clearly, actively listen, and tailor their language to prevent misunderstandings, promote adherence, and achieve better health outcomes. This central theme highlights the critical role of comprehensive and adaptable communication in all aspects of patient care. For instance, explaining a diagnosis in simple terms helps a patient grasp complex information. Always look for the overarching idea that ties together the main points of the text. Question 3. Which of the following words is a synonym for emesis? A. Constipation. B. Nausea. C. Vomiting. D. Diarrhea. Answer: C. Vomiting. This question tests medical vocabulary, a common component of the HESI entrance exam. Emesis is the medical term for the act of vomiting, which is the forceful expulsion of stomach contents through the mouth. While nausea is the sensation that often precedes emesis, emesis specifically refers to the act itself. For example, a patient might experience postoperative emesis after anesthesia. Expanding your medical terminology will help you understand patient reports and clinical documentation accurately. Question 4. Choose the sentence that is grammatically correct and uses pronouns appropriately. A. The nurse, along with her colleagues, plans their shift assignments. B. The nurse, along with her colleagues, plans her shift assignments. C. The nurse, along with her colleagues, plan her shift assignments. D. The nurse, along with her colleagues, plan their shift assignments. Answer: B. The nurse, along with her colleagues, plans her shift assignments. This question tests grammar, specifically subject-verb agreement and pronoun agreement. In phrases like along with, the subject is the first noun, the nurse, which is singular. Therefore, the singular verb plans is correct. The pronoun her then correctly refers back to the singular subject, the nurse, for the shift assignments. For example, the student, with her friends, studies for her exam demonstrates the same singular subject verb and pronoun agreement. Always ensure that the verb and pronouns agree with the true subject of the sentence. Question 5. The basic structural and functional unit of all known organisms is the A. Organelle, B. Tissue, C. Cell, D. System. Answer: C. Cell. This question assesses fundamental biology concepts. The cell is universally recognized as the basic structural, functional, and biological unit of all known organisms. All living things are composed of one or more cells, and cells are often referred to as the building blocks of life. For example, a single bacterium is a cell, and a human body is made up of trillions of specialized cells. Always remember the cell as the fundamental unit of life. Question 6. Which part of the human heart is responsible for pumping oxygenated blood to the rest of the body? A. Right atrium, B. Right ventricle, C. Left atrium, D. Left ventricle. Answer: D. Left ventricle. This question tests basic anatomy and physiology of the cardiovascular system. The left ventricle is the strongest chamber of the heart, with thick muscular walls, specifically designed to pump oxygenated blood under high pressure through the aorta to circulate throughout the entire systemic circulation of the body. For example, if the left ventricle is weakened, the body's tissues may not receive enough oxygen. Always remember the left ventricle as the main pumping chamber for systemic circulation. Question 7. What is 12% of 400? A. 36, B. 48, C. 60, D. 80. Answer: B. 48. This question assesses basic math skills, specifically calculating percentages. To find a percentage of a number, convert the percentage to a decimal by dividing by 100, 12% equals 0.12, and then multiply that decimal by the given number. So, 0.12 times 400 is equal to 48. For example, if a store offers a 12% discount on a $400 item, you would save $48. Practicing these percentage calculations is vital for various dosage and financial aspects in nursing. Question 8. In a healthy adult, which of the following respiratory rates would be considered abnormal and require further assessment? A. 12 breaths per minute, B. 18 breaths per minute, C. 24 breaths per minute, D. 16 breaths per minute. Answer: C. 24 breaths per minute. This question tests your knowledge of normal adult vital sign ranges. A normal adult respiratory rate typically falls between 12 and 20 breaths per minute. Therefore, 24 breaths per minute, tachypnea, is elevated and would be considered abnormal, indicating a potential respiratory issue or stress requiring further assessment. For example, an elevated respiratory rate could indicate pain, anxiety, fever, or a more serious respiratory condition. Always know the normal ranges for vital signs to promptly identify deviations in patient health. Question 9. Which component of blood is primarily responsible for transporting nutrients, hormones, and waste products? A. Red blood cells, B. White blood cells, C. Platelets, D. Plasma. Answer: D. Plasma. This question tests basic biology and anatomy/physiology, focusing on blood composition. Plasma is the liquid matrix of blood, primarily composed of water, about 92%, but also containing dissolved proteins, glucose, mineral ions, hormones, carbon dioxide, and blood cells. Its main function is to transport these essential substances throughout the body, making it a crucial component of circulation. For example, plasma carries glucose to cells for energy and transports waste products to the kidneys for excretion. Always remember plasma as the primary transport medium in the blood. Question 10. The process by which plants convert light energy into chemical energy is called A. Respiration, B. Fermentation, C. Photosynthesis, D. Transpiration. Answer: C. Photosynthesis. This question assesses fundamental biology concepts, specifically cellular processes. Photosynthesis is the process used by plants, algae, and some bacteria to convert light energy into chemical energy, glucose, which is then used to fuel the organism's activities. This process uses water and carbon dioxide as reactants. For example, without photosynthesis, there would be no oxygen in the atmosphere and no food for most living things. Always remember photosynthesis as the primary way plants create their own food using sunlight. Question 11. Choose the sentence with the correct use of effect or effect. A. The new policy will adverse affect the entire department. B. The new policy will have an adverse effect on the entire department. C. The new policy will adversely affect the entire department. D. The new policy will have an adverse effect on the entire department. Answer: D. The new policy will have an adverse effect on the entire department. This question tests grammar, specifically the often confused words effect and effect. Effect is typically used as a noun, meaning the result or consequence of an action, as in an adverse effect. Effect is typically used as a verb, meaning to influence or produce a change. For example, the weather will affect the game, verb, versus the weather had an effect on the game, noun. In this sentence, effect is correctly used as a noun following the article an. Always remember that effect, noun, is the result, and effect, verb, is to influence. Question 12. Which of the following substances acts as a buffer in the human body to help maintain blood pH? A. Sodium chloride, B. Bicarbonate, C. Glucose, D. Potassium. Answer: B. Bicarbonate. This question assesses basic chemistry and physiology, focusing on acid-base balance. The bicarbonate buffer system is one of the most important physiological buffer systems in the human body. It helps to maintain the pH of blood and other bodily fluids within a narrow, healthy range by either accepting hydrogen ions to raise pH or donating hydrogen ions to lower pH. For example, without buffers like bicarbonate, small changes in diet could drastically alter blood pH. Always remember that bicarbonate is a key player in keeping the body's pH stable. Question 13. Which lobe of the brain is primarily associated with vision? A. Frontal lobe, B. Parietal lobe, C. Temporal lobe, D. Occipital lobe. Answer: D. Occipital lobe. This question tests knowledge of basic neuroanatomy. The occipital lobe, located at the back of the brain, is the primary visual processing center. It receives and interprets visual information from the eyes, allowing us to see and understand the world around us. For example, damage to the occipital lobe can lead to various forms of visual impairment, even if the eyes themselves are healthy. Always associate the occipital lobe with processing visual input. Question 14. A client needs to receive 15 units of insulin. The insulin is supplied as 100 units/ml. How many milliliters, ml, should the nurse administer? A. 0.15 milliliters. B. 0.015 milliliters. C. 1.5 milliliters. D. 15 milliliters. Answer: A. 0.15 milliliters. This question tests basic dosage calculation, a fundamental skill for insulin administration. To find the volume in milliliters, divide the desired dose, 15 units, by the concentration available, 100 units/ml. So, 15 units/100 units/ml equals 0.15 milliliters. For example, knowing this calculation ensures accurate insulin dosing, which is critical for blood sugar control. Always ensure you understand the concentration of insulin to administer the correct and safe dose. Question 15. The medical term gastritis refers to A. Inflammation of the stomach. B. Surgical removal of the gallbladder. C. A viral infection of the intestines. D. Pain in the large intestine. Answer: A. Inflammation of the stomach. This question tests essential medical terminology by breaking down the word. The root word gastro/o refers to the stomach, and the suffix itis consistently indicates inflammation. Therefore, gastritis means inflammation of the stomach. For instance, a patient with gastritis might experience abdominal pain, nausea, and vomiting. Learning common prefixes and suffixes can help you decipher many medical terms without memorizing each one individually. Question 16. Which nutrient is primarily responsible for building and repairing tissues, as well as producing enzymes and hormones? A. Carbohydrates. B. Fats. C. Proteins. D. Vitamins. Answer: C. Proteins. This question assesses basic nutrition knowledge. Proteins are often called the building blocks of the body because they are essential for the growth, maintenance, and repair of all body tissues, including muscles, skin, and organs. They also play crucial roles in forming enzymes, hormones, and other body chemicals. For example, a patient recovering from surgery needs adequate protein for wound healing. Always remember protein's vital role in tissue repair and physiological functions. Question 17. In medical terminology, the prefix Brady- typically indicates A. Fast or rapid. B. Slow or delayed. C. Painful. D. Difficult. Answer: B. Slow or delayed. This question tests knowledge of common medical prefixes, which are crucial for deciphering medical terms. The prefix Brady- is consistently used to denote slowness or a reduced rate. For example, bradycardia means a slow heart rate, and bradypnea means slow breathing. Learning common prefixes and suffixes can help you understand many medical terms without memorizing each one individually. Question 18. Choose the sentence that correctly uses parallel structure. A. The patient enjoyed walking, swimming, and to cycle. B. The patient enjoyed walking, swimming, and cycling. C. The patient enjoyed to walk, to swim, and cycling. D. The patient enjoyed walking, to swim, and cycle. Answer: B. The patient enjoyed walking, swimming, and cycling. This question tests grammar, specifically parallel structure. Parallelism means using the same grammatical form for items in a list or series. In option B, all three activities, walking, swimming, and cycling, are presented as gerunds, verb forms ending in ing acting as nouns, creating a balanced and grammatically correct list. For example, she likes to read, to write, and to paint also shows parallel structure using infinitives. Always ensure all elements in a list follow the same grammatical pattern. Question 19. If a recipe calls for 3/4 cup of flour and you want to make 1/2 of the recipe, how much flour do you need? A. 1/8 cup. B. 1/4 cup. C. 3/8 cup. D. 1/2 cup. Answer: C. 3/8 cup. This question tests basic math skills, specifically multiplying fractions. To find half of 3/4 cup, you multiply the two fractions, 1/2, asterisk, 3/4. Multiply the numerators, 1 times 3 is equal to 3, and the denominators, 2 times 4 is equal to 8, to get 3/8. For example, if a client needs half of a partial dose, you would perform a similar calculation. Always remember to multiply numerators together and denominators together when multiplying fractions. Question 20. Which of the following is an example of a saturated fat? A. Olive oil. B. Avocado oil. C. Coconut oil. D. Canola oil. Answer: C. Coconut oil. This question tests basic nutrition knowledge. Saturated fats are typically solid at room temperature and are found in high amounts in animal products, like butter and red meat, and some plant-based oils, most notably coconut oil and palm oil. They are called saturated because their fatty acid chains have no double bonds and are saturated with hydrogen atoms. For example, excessive intake of saturated fats is linked to increased risk of heart disease. Always distinguish saturated fats from unsaturated fats, which are generally considered healthier. Question 21. Which gland is often referred to as the master gland because it controls the functions of many other endocrine glands? A. Adrenal gland. B. Thyroid gland. C. Pituitary gland. D. Pancreas. Answer: C. Pituitary gland. This question assesses fundamental anatomy and physiology, specifically the endocrine system. The pituitary gland, a small gland located at the base of the brain, is often called the master gland because it produces hormones that control the activity of most other endocrine glands, such as the thyroid, adrenal glands, and gonads. For example, it secretes growth hormone and stimulates other glands to produce their hormones. Always remember the pituitary gland's central role in regulating the endocrine system. Question 22. Which number is equivalent to 10 superscript 3? A. 1000. B. 0.1. C. 0.01. D. 0.001. Answer: D. 0.001. This question tests basic math skills, specifically understanding negative exponents. A negative exponent, like superscript 3, indicates that you should take the reciprocal of the base raised to the positive power. So, 10 superscript 3 is equivalent to 1 divided by 10 superscript 3, which is 1 divided by 1000. This results in 0.001. For example, 10 superscript 2 is 0.01. Remember that a negative exponent makes the number smaller, moving the decimal point to the left. Question 23. What is the primary function of the epiglottis? A. To produce vocal sounds. B. To prevent food from entering the trachea during swallowing. C. To filter air before it enters the lungs. D. To regulate the temperature of inhaled air. Answer: B. To prevent food from entering the trachea during swallowing. This question assesses basic anatomy and physiology of the respiratory and digestive systems. The epiglottis is a leaf-shaped flap of cartilage located behind the tongue and above the larynx, voice box. Its primary function is to fold over the trachea, windpipe, during swallowing, directing food and liquids into the esophagus and preventing aspiration into the lungs. For example, if the epiglottis doesn't function correctly, a person can choke or develop aspiration pneumonia. Always remember the epiglottis as the body's protective trapdoor for the airway during meals. Question 24. Which of the following statements about DNA is false? A. DNA stands for deoxyribonucleic acid. B. DNA is typically found in the nucleus of eukaryotic cells. C. DNA contains the sugar ribose. D. DNA carries genetic instructions for the development and function of living organisms. Answer: C. DNA contains the sugar ribose. This question tests fundamental biology concepts related to genetics. The false statement is that DNA contains the sugar ribose. In fact, DNA contains deoxyribose sugar, which is where its name deoxyribonucleic acid comes from. Ribose sugar is found in RNA, ribonucleic acid. For example, knowing the difference between these two sugars is a key distinction between DNA and RNA. Always be precise with the chemical components of macromolecules like DNA. Question 25. The medical abbreviation PO on a prescription means the medication should be administered. A. As needed. B. By injection. C. By mouth. D. After meals. Answer: C. By mouth. This question tests knowledge of common medical abbreviations, which is essential for safe patient care and understanding medical orders. PO is an abbreviation for the Latin phrase per os, which literally means by mouth or orally. This instruction directs that the medication should be taken via the mouth. For instance, a client might be ordered acetaminophen 500 mg POQ6HPRN pain. Familiarize yourself with common medical abbreviations to ensure you always administer medications correctly and safely.